Good afternoon, everyone. My name is Andrea James,
And I'm Rebecca Pogorzelski.
and today we want to share with you what we learned on our interview with Dr. Patrick Cawley. So a little bit about Dr. Cawley. He is the current Chief Executive Officer at MUSC. He is also the Vice President of Clinical Operations. Prior to being CEO, Dr. Cawley served as the Chief Medical Officer at MUSC. If you want additional information on his background, we have provided a link to a website that you can look up his CV. So now we want to move on into the interview. So our first question for Dr. Cawley was, when and how did you know you wanted to work in healthcare management? He knew early on his father was a physician and owned his own practice. He was always interested in the management side of his father's practice, i.e. helping his father with budgets and things like that. So when applying to medical school, he looked for a program that would allow him to pursue his MBA in addition to his MD degree. So he said this was back in the 80s, and around that time there was only 2 medical schools that would allow him to do that, as opposed to the variety of medical schools that will allow you to pursue the MD, MBA degree today. So our next question for him was, how has your MBA helped your career in medicine? He believed that it hasn't really helped his career in medicine. However, it has helped his management and leadership skills in 2 ways. Number 1, it has helped him learn the language of business. Number 2, he states that one cannot progress without having special credentials. This was different from 5 years ago, where experience was enough to get you up the ladder. So our next question for him was, would you recommend an MBA to other physicians? His response was no. He believes that one can be a fine physician or nurse without a business degree. However, if someone in the healthcare field wanted to pursue a business degree, he will recommend an MBA over an MHA. He stated that an MHA focuses more on healthcare than on the business side, and being in healthcare, these individuals are already familiar with how healthcare works. Therefore, he believes that they should focus more on the business aspects that the MBA will provide. So what does your average workday consist of? He says that he works 12 to 14 hours per day. 3 days of the week he's at MUSC. On any of these 3 days, 90% of his time is spent meeting people, whether that be one-on-one or in group settings, and a small portion of his day is spent rounding. This includes meeting the healthcare workers and patients at MUSC. The other 2 days he is spent on the road talking to hospitals and advocating for legislation, among other things. So what are some of the unique challenges that you face leading in today's healthcare system? His response was ambiguity of the future. He states that as opposed to other industries where it's clear where things are headed, the future of healthcare is very unclear and constantly changing, as we all know from taking this course. Does the fact that MUSC is an academic medical center play into the challenges that you face? His response was yes. This is because at an academic center such as MUSC, there are 3 products: healthcare, education, and research. And if one looks at a private hospital such as Roper down across the street, they only have 1 product, and that's healthcare. But he does state that academic centers have a secret weapon, in that because they focus on education and research, they acquire the best docs. So that does give them a little bit of an advantage over private hospitals. Our next question for him was, how has PPACA affected your job? And he says PPACA has caused more ambiguity. He states that it's causing transformative change, and with this type of change, one doesn't know what's coming next. He believes that transformative change was already in the works, but PPACA has just sped up the process.
So the next question we asked Dr. Cawley was, what is the biggest change you have seen take place at MUSC due to PPACA? And his first response was that there's been an increased focus on cost reduction. And one of the examples he provided was that MUSC is the biggest underinsured provider in South Carolina. And because of this, MUSC receives DISH funding, which stands for Disproportionate Sharing Funding. And before PPACA came along, the hospital received about $50 to $60 million for this purpose. So with the implementation of PPACA, this DISH money goes away, but theoretically it is supposed to come back to MUSC with the newly insured patients. So the new question is, how does MUSC survive with less DISH money? Since it's such a large amount, it could really hurt the hospital down the road. The next question, how has PPACA affected the university's strategic plan? There will not be as much money for the school in the future, so MUSC now has to prioritize. And something interesting we learned was that the clinical side of MUSC only makes money. The research and education side lose money, actually. And when the hospital receives a research grant, they have to actually cough up some of their own money to fund a portion of it. They have to match a certain amount of funds for these grants. And so more money towards the clinical side is essential to the success of MUSC, since that is the money-making side. Next question is, what trends in healthcare do you see emerging as a result of PPACA? Dr. Cawley said that there are not many new trends, but there were plenty of trends that were occurring before PPACA, and PPACA only sped up these trends. Some examples of these trends are that there's been an increase in patient responsibility, such that co-pays and deductibles are now higher. Another example is that we are now working towards population health, so that patients are healthier, which will hopefully decrease the healthcare costs. And another example is that there's going to be an increase in workforce size going forward in healthcare due to the implementation of PPACA. The next question is, what do you think healthcare will look like in 20 years? Do you think we will still be having the same problems that we face now? And Dr. Cawley is hopeful in that it will be different, and that there will be more of a population-centric focus. He also hopes that there will be more preventative health measures and incentives to do so. And something to keep in mind is that healthcare moves and changes slowly, so the same problems that we face today will still be present down the road, say in 20 years. And Dr. Cawley is also hopeful that the social determinants will change somewhat too. And some examples of these social determinants are where the patients grew up, what their eating habits are, and etc. The next question, what advice would you offer to someone who is interested in entering the healthcare management field? And like Dr. Cawley mentioned in previous questions, that there's a lot of ambiguity in healthcare right now. So you must like ambiguity and you must like change. There is a lot of gray area in the healthcare management field. So it may not be the best fit for someone who is very black and white and does not like change. But going forward, he thinks that there's a lot of opportunity in this field, so he encourages anyone who's interested to pursue it.
So we want to make some final comments about things that we've learned from this interview. Dr. Cawley really taught us a lot in 45 minutes. One thing that we learned was the difference between running an academic center versus a private hospital, such as MUSC versus Roper. And what was striking for us was that research really doesn't make any money. People think that the government gives you funds or grants for research, but the hospital actually has to cough up a percentage of that money to fund whatever the research project is. Also, it was interesting to hear a CEO's view of how PPACA is affecting healthcare, because while some people think that, I guess we have different sides. Some people think that PPACA is great, and some people think that it's not so great. But what Dr. Cawley thinks is that PPACA just sped up everything that was happening in healthcare already, such as consumerism, where he said back in the 90s, patient paid little to nothing for the healthcare, and gradually they've been paying more, and PPACA just sped that up. The same with quality and safety measures, and things like that. So he basically stated that PPACA put trends that were already happening on steroids.
So another point that Dr. Cawley talked about that we found interesting as well is the DISH funding, which again stands for the Disproportionate Sharing Funds. And this is given to MUSC by the government because they are one of the larger underinsured providers in South Carolina. So the government typically funds about $50 to $60 million to MUSC for this purpose. And these funds are going to go away with PPACA, but the idea behind it is that these funds will come back to the organization when the newly insured patients return. But this may not be the case because with PPACA there are now more options for these patients to visit, such as Trident or Somerville Medical or something like that in the area. So these patients may not return to MUSC, so they may not recoup this money. And the final point that we would like to summarize is how interesting it is that there's so much uncertainty about the future of healthcare. Dr. Cawley mentioned several times, as you can see in our presentation, that ambiguity is ever present in this field and it's only going to get worse. So it's important to stay abreast of the current trends and to be knowledgeable about PPACA and its implications. So this concludes our presentation. Thank you very much for watching.